Onto this now. COVID-19 cases in the country are on the rise once again. But Health Minister Joe Phaahla says that the country is on the verge, but not yet, in the fifth wave. He says that the situation will be closely monitored, and the minister was giving an update a little earlier. Let's discuss this further with Professor Mosa Moshabela from the University of KwaZulu-Natal. Thank you very much for your time this morning, Prof. Maybe let's just ventilate this issue of the fifth wave a little bit further. The minister saying we are on the verge, but we're still monitoring the situation. How far would you say we are from that point?
Yeah, good morning, Rofhiwa, and the viewers as well. I think the challenge is just knowing the right metrics to declare the fifth wave. And the fact that the situation has changed at the moment. One is that we are seeing it slightly earlier than we thought we would see it, but we did expect it around this time. But also, I think because we expected it to be driven by a completely new variant, but actually it's still being driven by Omicron. So because of the complexity of the immunity and the variants and so forth, it's difficult to know whether the increase we are seeing is going to be sustained long enough. As we have seen previously, with the sub-variant of BA2, it wasn't sustained very much. It came immediately after the first one, the BA1, around. That because of that, Rofhiwa, it makes it difficult for us to say with definitiveness that this is the fifth wave. But all the metrics that we normally monitor around cases indicate that we are in the fifth wave.
And as we are within that fifth wave, Prof, let's talk about the severity of it, given the fact that we've seen vaccinations, booster shots are being handed out as well, the anticipation of the level of severity in this particular wave.
Yeah, no, it's important to indicate, I think, from the side of the subvariants, so far we know that they are likely to be transmissible and they are likely to escape immunity to some extent because they are already causing reinfections. But we don't have any evidence yet that the variants themselves are causing severe disease. So I think that severe disease, therefore, is going to depend more in terms of the immunity of the population. I think people who have the immunity will be better protected. And I think that's why we are saying that everyone needs to ensure that they are boosted if they need to, and also people are vaccinated so that they have immunity and they can be protected. But otherwise, I think that the hospitalizations so far are increasing slowly. We are still seeing what we saw in the fourth wave, which we call decoupling. So where you've got a rapid increase in cases, but the hospitals are not increasing at the same pace. And we are not yet seeing deaths as well. So I think we expect and hope that the severity of the wave would not be any worse than what we saw with the fourth wave, whereby even if you have a lot of cases, should that happen, that you will not have a lot of hospitalization. So that's our hope at this point, and the evidence is in keeping with that for now.
And then what is the evidence telling us, or the matrix that you use to look at what's currently happening in terms of how long this particular wave will last?
Yeah, that's a very important question, and that's the part that we don't know. We don't even know that next week it would be sustained because of the complexity of what we are seeing now. But I think if it was driven by a completely new variant, then we could predict it better. But this one, I think, is very difficult because we think that there may be some degree of immunity already in the population for any subtype of Omicron. So for that reason, I think it's very hard to tell how high it's going to go and how long it's going to last. If we don't have a new variant introduced, then we don't expect it to last very long. It will be similar, perhaps, to what we saw with the fourth wave. But if we have an introduction of a new variant, because we have not excluded that possibility, then we might actually see it prolonged a little bit by the new variant. So it just depends on those factors. But for now, we will work with the information that we currently have.
Prof, in your thoughts, what does this do to the current policy adjustments that have been made by a government in terms of lifting the national state of disaster, having discussions about discontinuing the wearing of masks, the mandatory wearing of masks? Do you think that maybe these conversations should be re-looked at given what you all are seeing?
I think it does a number of things, Rofhiwa, and for me, it does bother me. I think that I agree generally with the position for the state to end the state of disaster, but maintain in some ways, the interventions to protect South Africans. I think what has happened, what we are seeing now is that the state is going to be largely responsible for making sure that the health system is able to cope. But I don't necessarily think that the behavior factors that we know tend to influence the infections and the spread of infections, that government is going to have a lot to do with that. I think what's going to happen is that the whole notion of personal responsibility, it's in your hands, is what's going to apply when it comes to the exposure to infection and management of spread of infections. And so I am concerned that a lot of people are going to be infected and they might have mild disease, but if they have mild disease, they may still end up with long COVID. And also, I think because people are not using masks, they are likely to have co-infections and super infections. So a person with COVID can still get flu, and if they get flu, then they tend to have more severe disease. Or if they have another respiratory virus or pathogen, they can end up with severe disease because COVID-19 also impairs immunity. So those co-infections and super infections are really my concern. Lastly, Rofhiwa, I'm concerned about people who are most vulnerable. I think the people who basically live on the margins of society, people that may not have resources to be able to get the tools they need to look after themselves, to have themselves tested and so forth, may have COVID and not even know, and may have COVID and not be able to access care, thinking that it's just flu or it's just cold or something like that. Those would be my concerns. But otherwise, I think this is where we are at, that personal responsibility will play an important role here, and government will largely oversee the health system.
No, absolutely. Thank you very much, Professor Mosa Moshabela, for joining us this morning. He's from the University of KwaZulu-Natal, talking us through the latest wave of COVID-19, how long it may last, and of course the implications there.